I think it does two things. One, it encourages people who might be a bit reluctant to have a vaccine. If you're not reluctant and you're enthusiastic, you'll already have had it done, whether you're in France or in the UK. But it also means that only people who've been vaccinated, who have a reduced chance of transmitting the virus onto other people, are able to mix in certain venues, in certain places. So that does inevitably reduce the opportunity for the virus to spread, reduce the chances of asymptomatic infection, which of course can be spread on to other people. So it should have an effect. The big question is, how big is that effect?
Okay, now you're in the UK, so-called Freedom Day was on Monday. You don't have to wear a mask or socially distance as previously required. Can you give us any sense of what the impact of lifting of those restrictions will have?
Well, it seems actually not very much at all. I was in London yesterday for lunch, and most people on the train into London were wearing masks. Oddly, you don't have to wear masks on a train, but you do on the subway in London, the underground trains. And I would say fewer people were wearing masks there, probably a bit less than 2/3, where it is actually mandated by the Mayor of London. Otherwise, to be honest, walking around London, it didn't look like much else had changed.
Now, here in France, back on the 12th of July, the Pasteur Institute said that ivermectin does help with COVID infections. The news it didn't get a huge amount of attention here, but what would you say from the point of view of immunity and microbiology about the focus on treatment of COVID as opposed to the focusing more or less solely on vaccines?
Well, it's crucial that we get drugs that can treat COVID. We do have some. We have or some drugs that can make the disease less severe when you're in intensive care. Ivermectin is a difficult one because there are a lot of very conflicting pieces of evidence, and it needs to be remembered that even manufacturers, Merck, who would stand to make an awful lot of money out of ivermectin being used, have said it doesn't work. Ivermectin is an antiparasitic. It is used in sheep dip. It's not a classic antiviral drug, but it doesn't mean it wouldn't work. But the research into this is highly mixed. To suggest that it all goes one way or the other doesn't hold water. That's not true.